We start with a Fox News alert on the future of the kind of health care you get. After months of intense negotiations, the Senate Finance Committee chairman is releasing his health care reform proposal. Good morning. I'm John Scott, along with Jane Skinner. Democratic Finance Committee Chairman Max Baucus today introducing what he calls the America's Health Future Act. It's an $856 billion package. It would require each American to buy health insurance or pay a fee, but it does not include the controversial public option that would create a government-run insurance program. Senator Baucus, writing on the opinion page of today's Wall Street Journal, says, quote, "The time has come to act, and we will act." Our chief political correspondent, Carl Cameron, is live on Capitol Hill. Nobody can decipher this stuff better. So is this his bill, or is it his committee's bill, Carl?
Well, it's not a bill by any stretch of the imagination yet, John. In fact, what we have here is a lot of paperwork that Senator Baucus would like to have turned into a bill by his committee. He had hoped today, with a news conference that's going to come up here in the Senate Finance Committee, he'll be here in an hour to talk about it, and he had hoped for months that he'd be flanked by his so-called gang of six, which is 3 Republicans and 3 Democrats. Instead, he'll be flying solo on this because none of the members of the Senate Finance Committee are prepared to sign on to this, the raw language. They're going to spend the next week trying to turn it into a bill, and there's a lot in it, and it's fairly complex. Here's what we can tell you, and we've got a graphic to sort of run through this. It's $856 billion, which is considerably less than the originally predicted 888. It has mandatory individual insurance with a fine if you don't comply with that of up to $3,800. The government would run what's called a web-based insurance exchange to essentially standardize premiums and cost information. It'd be like a shopping mall for the insurance companies. There would be a choice of a government-initiated nonprofit co-op, which when you break it out stands for consumer-owned and oriented plans. Now we get into the numbers. $349 billion in new taxes and fees, and that includes a 35% tax on top-shelf Cadillac-type insurance programs and a $6 billion flat fee that would get slapped on the insurance industry. There's $507 billion in cuts to government programs, and that includes Medicare, which is freaking out a lot of Democrats. This would stop private insurance companies from canceling coverage for existing conditions, and there is a big concern that some of the issues that were offered up by Democrats to win Republican votes aren't really quite in here. One example of that, John, is medical malpractice reform. Senator Baucus, the Democrat, had been insisting that be in there. It turns out that there won't be the force of law, at least in the Baucus proposal. What he says is that there would be a sense of the Senate, a non-binding resolution, that health care reform overall creates a nice opportunity to do medical malpractice reform. That's a far cry from the actual reform that Republicans expected to be getting.
Carl, I know you're at the Capitol building, but are you hearing any screams of opposition from Pennsylvania Avenue, the White House?
Well, the White House isn't going to oppose anything. They want to continue the momentum going. And part of what's happening behind the scenes is Baucus's hope that by laying this out there and sort of increasing the pressure on Democrats and Republicans alike, he can get a little bit of momentum in the committee and get something on the Senate floor. Let's not forget that the Obama administration said that the deadline for legislation out of the House and Senate was supposed to be before the August recess. There was a reason that they pushed that deadline, John. They know that the calendar gets real busy in the fall with budgetary problems and hardened positions on party lines. And in this particular case, the country is tremendously engaged in a very intense debate. Positions are hardening, time's running out, and there's very little progress. The chairman wanted to be unveiling a bipartisan bill. Instead, it's his own proposal just to kind of restart things.
Well, the White House may not be screaming, Carl, but as you were speaking, we got this statement in from Mitch McConnell, the leader of the Republicans in the Senate, as you know. He says the partisan proposal cuts Medicare by nearly $500 billion and puts massive new tax burdens on families and small businesses to create yet another 1,000-page, trillion-dollar program. Only in Washington would anyone think that makes sense, especially in this economy. Doesn't sound like the Republicans much like this plan.
And there's bipartisan agreement on what you've just described, John. A short time ago, Senator Bill Nelson of Florida went to the floor of the Senate and made a promise that he would put forth amendments to try to restore some of those cuts to Medicare. Democrats are worried about the cuts to Medicare. Republicans are worried about the cuts to Medicare. The opposition is bipartisan. It's a cliche, but it's true.
All right.